board members. My name is Seaton, and I'm the president of the San Marcos Educators Association. I want to thank you for your service. I want to thank you for your support of our staff members. I want to thank all of the retired teachers for the 870 years that they gave San Marcos. I'd also like to share with you my story tonight about why we're asking for increased pay and increased healthcare contributions. I know this isn't an item until next month, but while these teachers are here before we leave for summer, I want to bring it to the forefront of your collectiveness. I want to make sure that you know why this is such an important avenue for us and such an important issue. I take the district's health insurance because I'm not allowed on my husband's health insurance, so I don't have a choice. I take the high deductible plan at $88 a month because I can't afford the $300 a month that the higher plan would call for each month because I have 4 children and a mortgage. Now, when I take that high deductible plan, my deductible is $2,500 and my plan pays nothing, not 1 single cent for a doctor's appointment, a lab work, or a prescription until I meet that plan. I am 46 years old. I'm a proud staff member of San Marcos, but I am 2 months from having a stroke because I could not afford to pay for my medications for my diabetes. My lab work, in order to get my 3-month prescriptions, costs $675 out of pocket. That's every 3 months. My diabetes medication, one of them costs $10, the other one costs $270, and the next one costs $380, and that's with manufacturer's discount cards. Okay? I have many others. The fact that I can't afford lab work and I can't afford my medications led to my stroke. Now I'm recovering, but I want to tell you that I'm not the only one. I make a teacher's salary. Think about the bus drivers and the custodians and the maintenance workers who make half of what I make but still pay the same thing. As you get ready to go into budget talks, I know you're going to look at this. My challenge to you is, instead of bringing a balanced budget to the board and then deciding on teacher and employee compensation and health care, I challenge you to put that in first. Okay? Make your budget around the most important assets that you have in student success, and that's your staff members. Okay? So please think about it. We'll be glad to provide you with any information, and we also applaud you on your class size discussions later on this evening. So please, we are in complete support of you. We have seen some proposals. We would like to see the rest, and we're asking you. We would like the 5% raise and the $88 in health care. So please think about this as we get into the budget talks. Thank you.
Next speaker is Aponte, speaking on raising and increase.
Good evening, board. My name is Aponte. I'm a teacher. I've been a teacher since 1992. I've been in the school system since 1987. I am 50 years old. It saddens me to see a brand new teacher making a difference of $8,000 compared to a 21-year veteran like me. That person is looking for $2 a day by the time to reach 21 years of service. I love this district. I love my job. And I take my job serious. I work with newcomers, in which all of my students do well in high school and succeed. I have students that call me in every weekend to say how you're doing after 15 years that I have not seen you. I'm a proud teacher, but I would like this board to consider the 5% raise and the health benefits increase. Not for me, I'm 21 into the system. I'll be retiring soon, even though it will be great. But for those young teachers that are coming in with the idea of teaching that they'll give up within 5 years because of the money. I didn't get into this profession because of the money, but today money is important. Before there was a superintendent or a principal, it was a teacher that started everything. Let's give them what we deserve. Not for me, but for the new ones, so they can feel empowered and say, yes, education is important. Health benefits, well, I take the highest deductible, $88 a month, because I cannot afford the high deductible. If I were to afford the high premium, I would have to pay the $350 plus $350 for my medication. So I just want to share that with you. Please consider it. I know it's in the now, but next month, but think about it. Thank you. Good evening.